So tell us about your training model as an informaticist. How did you come into that? As you said, it was serendipity. Who influenced you, and what do you do in that space today?
I kind of think of myself as a lot of times being a translator for people. So we work obviously with the IT professionals who are the ones who are actually building and maintaining things. And then we also have training like Epic, our vendor, specifically on how things work in the system as well. But informatics is not just EHR and what the system, it has a lot to other do with like different like data standards, things that go into how information gets processed behind the scenes. There's billing components, there's project management components, so there's a lot that goes into that.
So give me an example of something that an informaticist is doing that I have no idea they're doing, but it's helping to make my life easier as a doctor.
So good example. So like one of the things that we're working on right now, like one of the big projects I'm involved with is we're working on different like AI models.
Okay.
With the hospital. One of them is a model like what we call like a no-show model.
Okay.
So basically, is there a way that we can predict like patients who are going to show and not going to show and whatnot, and how we can make sure we get access to care for everybody,
Sure.
and to help improve that. Other things I'm working on behind the scenes is how to make the tools that we have work better.
Like what?
So we have something that's called smart sets through Epic, and they're kind of like have a algorithm in place, so we're able to implement like all the best clinical decision support like for that particular field. So we work with experts in that field, and it has everything all in place, and it also has like different links to different websites, different algorithms. It has all different medication and dosing and whatnot in there, and the goal is to help providers be more efficient, also to help them be more accurate and get the patients the best care that they need to at the right time.
Have you been able to realize some of those efficiencies, or are we still working on it?
Yes, actually, one of the QI projects that I'm working on, or right now, is starting with the GI division. So one of the things we wanted to do was improve our utilization of these smart sets, because we know that there's been multiple studies in the literature that shows that using these organized smart sets not only helps improve burnout among providers, help to improve care with patients. So my goal was to improve that in our division, and we're able to go upwards. I think we're right around 45% right now utilization, where we were probably like at 1% when we started.
Wow, that's a huge bump.
So within a year, we were able to make very big strides at that, and that's actually something I'm working on publishing at this point.
So have your colleagues reported that it's actually better or easier or faster? What are you hearing from them?
Yeah, because one of the things I actually did, I sent out a couple different surveys to kind of see how they felt about them. And I know especially one of the fields where I feel like it's been very beneficial is with our new trainees, people who are coming directly out of fellowship, or our nurse practitioners really like them, because it's like, wow, it has everything I kind of need right there.
That's really cool.
It really adds some extra support.